Hi there, Dr. Zwelling here. I want to talk to you now about going to the doctor. When the heck should I go to the doctor? What needs to be checked up and when do I need to get it checked up? You know, it's a very confusing marketplace now because the government has entered into it and we now have the preventive care task force trying to tell us when and what we need. Wrong place to go. When was the last time you asked the government for, good life decisions? Not. So let's use a little bit of common sense. First of all, the various specialty societies have actually posted on their websites the kind of preventive care that is best, the kind of testing that you really need. You might want to go there. But again, let's apply some common sense. God forbid your mother died of breast cancer. Her mother died of breast cancer. Common sense would tell you, maybe, even at an early age, even as a teenager, it might be something that you want to talk to somebody about. If everybody has breast cancer in your family, it would seem that that might be a risk for you. So mammograms are important, and what we recommend as a general rule, for instance, is every year in a woman after the age of 40. But maybe that's not where you want to spend your money. If you have no history of breast cancer in your family, but you have a horrible history of heart disease and stroke, and your father died of a heart attack at the age of 45, maybe you want to talk to your doctor about heart attack prevention. So the answer to the question of what do I need and when is really a reflection of who you are. What worries you? Getting an extra test once a year, getting an extra mammogram for your own personal reassurance has tremendous value. And let me take away some of the myths. How much does the mammogram cost? Well, in October, which is Breast Cancer Month, the average cost of a cash-based mammogram in this community is $75. If I don't get my mammogram done in October and I go over to the imaging center in December, it costs me $96, and that includes the reading of the doctor. Now tell me that you cannot afford $96 a year if that is a concern. That's a cash-based program. So when you go to get your mammogram, ask the hospital not for how much it's going to cost if you send it through insurance, but what is the cash price of a mammogram. You'll get a much better price. Now, when should you go? Again, every year after the age of 40. God forbid if you feel something in your breast, and you should do daily breast exams, and you have a question, first go to your doctor, because a mammogram is not always the best test to get. Sometimes an MRI is better. Many times an ultrasound, particularly in young people with very dense breasts, a mammogram is not a great test. So, the answer to the question is, what do you need for preventive care? Depends on you, the patient. What's worrying you? What are your genetics? You might want to get some genetic testings. And what does your doctor think? Preventive care is not in what's good for one is good for all thing. Population-based health care, when we're checking off boxes, is very expensive and does nothing to address your questions. So dig deep, and what concerns you? What are your concerns? Maybe preventive care for you is going in and get a cholesterol level. Whatever it is for you, you need to talk to your physician about it. What are your risks? Where do you want to spend your time and money? And what will let you sleep better at night and be more productive? That's the real answer to the question. As for the general rule of thumb and for the recommendations of the American medical community, I would go to the website of the specific medical association. The American Diabetes Association, for instance, the American Breast Association. There are tons of associations, the American Cancer Association, and you can find some of the answers to those questions. But remember, they're answering the question for a population and not about you. Your life is about you. So when asking questions, make sure that they're directed personally to you and your family. Thank you.